Stroke symptoms 1 month before they happen. Fast detection. Have you ever felt just off? A bit more tired than usual? Maybe your words didn't come out quite right, or your vision went fuzzy for a moment? Most folks chalk it up to age or stress, but what if your brain was trying to warn you a full month in advance? I've spent over 30 years helping people understand their stroke risk, and I can tell you this: your body often whispers before it screams. Today, we'll walk through 7 early signs of stroke you can spot before it's too late. And I'll also help you understand the different types of stroke, how aneurysms are involved, and what steps you can take today to protect yourself and your loved ones. Let's get into it. Symptom 1: persistently high blood pressure. Let's begin with something silent but incredibly dangerous: high blood pressure. Take Robert, 68, played pickleball every weekend, looked fit. He never missed a walk with his dog. But his blood pressure had crept up for months: 145, 155, then 165. He felt fine, no headaches, no chest pain, until one day he collapsed. A hemorrhagic stroke from a burst vessel in his brain. The CDC reports that nearly 1 in 2 adults in the US has high blood pressure, and only 1 in 4 controls it. That pressure silently damages artery walls, especially the fragile ones in the brain. Over time, they weaken, they stiffen, and under pressure, they can tear or rupture. This is why high blood pressure is the #1 modifiable risk factor for stroke. So even if you feel perfectly fine, if you haven't checked your blood pressure recently, it's time to do it. Symptom 2: unexplained fatigue. Now let's talk about tiredness. I'm not talking about being sleepy after a late night. I mean the kind of fatigue that feels heavy, that lingers, that keeps you from doing what you normally do. Susan, one of my retired patients in her early 70s, was always on the move, active in her church, cooking for neighbors, walking with her book club. But for about 3 weeks, she said, I felt like I was walking through molasses. I just couldn't shake the tiredness. We ran tests. It wasn't her thyroid, not an infection. But then a scan showed she had suffered a transient ischemic attack, a mini stroke. According to the American Stroke Association, about 30% of people who experience a TIA will go on to have a full stroke within 90 days, many within 48 hours. So if you're feeling fatigue that's unusual, especially if you have risk factors like high blood pressure or diabetes, don't ignore it. Symptom 3: vision changes. Next, vision. Your eyes and your brain are deeply connected, so when blood flow to your brain is compromised, it can show up in your sight. Harold, another patient of mine, started squinting more, said he needed better lighting. But what he was really experiencing was blurry vision in one eye, which would come and go. He thought it was just age, but it turned out to be a narrowing of the artery feeding his retina. The National Institute of Neurological Disorders and Stroke confirms that sudden vision loss, especially in one eye, may signal an ischemic stroke. Other signs include double vision, dimming vision, or feeling like a curtain is being pulled over one eye. If that happens to you, even for a few seconds, get evaluated. Symptom 4: sudden, severe headache. I once treated a 65-year-old woman who came in holding her head and crying, "It feels like lightning exploded in my brain." She was having a hemorrhagic stroke from a ruptured aneurysm. That's what we call a thunderclap headache. It's sudden, intense, and different from any headache you've ever had. Now, most headaches are not strokes, but if the headache hits out of nowhere, It's debilitating. You feel nauseous, confused, or pass out. That's an emergency. Call 911. Don't drive yourself. Time saves brain cells. Symptom 5. Numbness or weakness on one side. Let's go back to basics. Stroke is often about asymmetry. One side of the body stops working properly. Arms, legs, face, they just go weak or numb. Jim, 74, dropped his coffee mug out of nowhere. His right arm just let go. He said, "I didn't feel anything wrong. I just couldn't hold it." This is one of the most recognizable stroke signs. The National Stroke Association says that nearly 9 out of 10 strokes involve one-sided weakness or numbness. If it lasts more than a few seconds or comes and goes, it needs to be checked. Even if it fully resolves, that could have been a TIA, and the next one might not be so forgiving. Symptom 6. Trouble speaking or understanding. Linda, 69, was chatting with her husband at breakfast. She opened her mouth to say, "Could you pass the toast?" But what came out sounded like jumbled noise. She looked confused, scared. That's aphasia, a breakdown in the brain's language centers. It can mean slurred speech, struggling to find words, or not understanding what others are saying. Johns Hopkins Medicine confirms that speech and comprehension problems are common stroke symptoms, especially when the left hemisphere is involved. If you or someone you know is speaking strangely or suddenly can't understand basic sentences, call for help. Symptom 7. Balance issues, confusion, and nausea. Finally, let's talk about the sneaky ones. Balance, coordination, sudden confusion. These are signs of a stroke in the cerebellum or brainstem. I remember treating a man in his early 80s who came in after tripping twice in a day. He felt dizzy, nauseated, and said, "I just feel weird." No facial droop, no slurred speech, but it was a stroke. Sometimes stroke doesn't fit the classic signs, but if you suddenly feel off balance, dizzy, confused, or can't walk straight, don't brush it off. It could be your brain crying for help. Understanding stroke types. Let's make this simple. There are 2 main types of stroke, and knowing the difference could save a life. Ischemic stroke is the most common kind. It happens when something blocks the blood flow to a part of your brain. Imagine a clog in a pipe. That clog might be a blood clot or a buildup of fatty deposits called plaque. When blood can't get through, brain cells don't get the oxygen they need. Hemorrhagic stroke is less common but often more serious. It happens when a blood vessel bursts inside the brain and blood starts leaking where it shouldn't. It's like a pipe that bursts and floods a room. The blood puts pressure on brain tissue, damaging it very quickly. According to the American Heart Association, about 87% of strokes are ischemic and 13% are hemorrhagic. Both types are medical emergencies that require fast action. Cerebral aneurysms, know the risk. Now, there's one more condition we need to talk about: brain aneurysms. Think of an aneurysm like a small balloon forming in a weak spot of a blood vessel in your brain. Most of the time, they don't cause any symptoms, and people don't even know they have one. But if that balloon bursts, it can cause a hemorrhagic stroke, and it can happen in seconds. The Brain Aneurysm Foundation estimates that 1 in 50 Americans has an unruptured brain aneurysm. Most are never discovered unless they start to leak or burst. So who should get checked? If you've had a first-degree relative, like a parent or sibling, with a brain aneurysm, if you have severe, sudden headaches, especially if they feel like the worst headache of your life, if you experience double vision, neck stiffness, nausea, or even fainting spells, talk to your doctor. Tests like CT angiographies or MR angiography can detect aneurysms early, before they become dangerous. It takes just a few minutes to scan, but it could give years of peace of mind. What you can do today to prevent a stroke. Here's the part I always find the most hopeful. Up to 80% of strokes are preventable, according to the CDC. And prevention doesn't require perfection, just a series of small, consistent decisions that support your brain, your heart, and your overall well-being. Let's go over the most important habits. Check your blood pressure regularly. Keep it below 130 by 80 millimeters of mercury. Use an at-home monitor or visit your pharmacy or doctor. Even small reductions make a huge difference. Control your blood sugar and cholesterol. Ask your doctor about your A1C and LDL levels. If you have diabetes or prediabetes, manage it closely. Damage to blood vessels happen quietly but persistently. Move your body every day. The American Heart Association recommends at least 150 minutes of moderate activity each week. Walking, swimming, tai chi, anything that gets your heart rate up. Eat with your brain in mind. Prioritize leafy greens, berries, legumes, omega-3 rich fish like salmon, whole grains and healthy fats. Avoid ultra-processed snacks, excess salt, and sugary drinks. Get quality sleep. Aim for 7 to 8 hours of uninterrupted rest. Sleep apnea is a hidden stroke risk. If you snore loudly or feel exhausted in the morning, talk to your doctor. Don't smoke, and limit alcohol to no more than 1 drink per day if you do drink. Smoking damages artery walls and promotes clot formation. Manage stress wisely. Chronic stress raises cortisol, blood pressure, and inflammation. Practices like meditation, prayer, slow breathing, music, or gardening can help calm your nervous system. Stay socially connected. Loneliness is a serious risk factor in older adults. Reach out, join a group, call a friend. Social health supports brain health. And above all, listen to your body. If something feels off, even if it's vague, don't ignore it. I've seen lives changed and lives saved just because someone spoke up early. Stroke doesn't always hit like lightning. Sometimes it whispers, a little weakness here, a slip in speech there. But if we listen to those whispers and act early, we can change the outcome. You are not powerless. You are not alone. And you deserve a brain that stays strong and sharp. So, if this video spoke to you, please share it with someone you care about. And if you haven't yet, subscribe to our channel for clear, compassionate, science-backed health insights every week. Until next time, stay informed, stay connected, and take care of that brilliant brain of yours.